Dr. G here from Natural Foods Diet. If you've been looking for another reason to avoid statins to lower cholesterol, I've got it for you today. The drug companies and the medical system has everyone trained to think that any cholesterol over 200 is a disease that needs to be treated with a drug. Of course this is wrong, and many physicians and more patients are beginning to realize this. Actually, a person can be perfectly healthy with a cholesterol over 200, and there's absolutely no intervention that needs to be undertaken. Most cardiologists realize that the reason that statin drugs reduce heart attacks is because of their anti-inflammatory effects, and not the cholesterol lowering per se. Most of the randomized trials using the statin drugs for primary prevention showed benefit in the reduction of heart attack, but no improvement in life expectancy. That means that if they reduce the number of deaths from heart attacks, then they must have also increased the other causes of death for there to be no mortality improvement. So that brings me to the study I want to talk about today. Duke researchers were looking at terminally ill people that were on statin drugs. They were thinking, why should I give a medicine to prevent heart attacks if someone has only a year to live? They were actually looking for a way to save money. That's actually not a bad point. So they did a study of people that had less than 1 year to live that were on statin drugs for their cholesterol. Half were taken off the drug and the other half were left on the drug. The results of the study are eye-opening, and they were presented at the annual meeting of the American Society of Clinical Oncology this year. First off, the patients taken off the statin drugs lived almost 40 days longer than those remaining on the drug. And those taken off the statins were also found to have a better quality of life, especially psychological well-being. That seems to support my hypothesis that statins are poisonous and shorten your life. They sure were poisonous in this study, as well as making those on statins feel generally bad. If you have heart disease with plaque in your arteries, especially if you've had stents or bypass surgery, your doctors will demand that you be on statins. This is also usually true if you're diabetic. My question is, why don't we have better drugs to reduce inflammation to decrease heart attacks? Why have we had at least 8 different statin drugs approved in the United States? And believe it or not, the drug companies are continuing to introduce new ones, even when this is obviously a very poor way to treat inflammation. I'll tell you why. It's because the statins have been a cash cow for the drug companies. And that's the reason we have so many versions of the same bad drug, which is modeled, by the way, after a poison in nature. Now, this is a cash cow to the tune of $25 billion a year. Now you can understand why this bad drug is the centerpiece for cardiovascular disease treatment. The science and technology are available today to make way more effective and safer drugs. But unfortunately, the drug companies want to stick with the cash cows. So let's see, 8 versions of the same poison. Now when it comes to health, in the present system, money rules. This is Dr. G, and together we can change that. Thanks for watching.